Welcome to Keeping Secrets, hosted by Julia Baum and Sabrina Tropper.
We're two licensed therapists here to give you an insider's perspective on therapy in today's modern world.
Whether you're a therapy goer, you've never been to therapy, or you have experience in the field, this podcast is for you.
We thank you for listening. Subscribe to Keeping Secrets to never miss an episode, and we hope you enjoyed today's show.
Hey,
Hey,
you got your new microphone?
I do. I got it today. Can you hear me okay on it?
Yeah, it sounds good.
Good. Okay. Oh, good. Thank goodness. Yeah, it was the old microphone that I got that was just not doing anything. But yeah, how are you?
I'm all right. Yeah.
Yeah, are you
I'm
sure?
like slightly frazzled at the moment, but I'm just gonna like zone in to
Is ever
our podcast. Everything's fine. It's just like life irritations.
Yeah.
Nothing really.
Okay.
But yeah, how are you?
I'm good, thanks. I'm also a little frazzled too, but not in a bad way. And again, I think I had told you last time I kind of removed some things from my plate a little bit. I'm so happy I did that. I don't know what I thought I was capable of, frankly. Yeah.
I
Anyway.
feel like when you have free time, it's kind of easy to fill it and then like overfill it or something.
Yeah, and the truth is that I think I thought I had more time than I do because I just prioritized. I didn't think about what I was supposed to be prioritizing and didn't realize how much time. Anyway, you know, and that's a consistent issue that I've worked on or whatever.
Yeah, there's like,
you know,
also like kind of an energy cost, I think. Like you can only be like energetic and like focused on so many things.
I think you're 100% correct on that.
Yeah.
I think it was more an energetic thing for me. I want to say. And now I'm kind of realizing a little bit better. It just feels so much better, honestly, to have my plate a little bit cleaner.
Yeah, that's good. I mean, you do seem more calm.
Thank you. It's a sign.
Yeah. Okay, so our episode today is about mental health buzzwords. And we've had some discussions about this, and we've done some online exploring just to see like articles and Reddit threads and things that people talking about, I don't know, everything from like their gripes to using these words like they're real. And so I guess we're gonna just kind of go through some of the ones that stood out to us and discuss.
Yes, we are. Thank you, Julia, for starting us off. I'm going to be honest, I didn't even fully realize that we were recording, so this is lovely. But this is we might want to cut that piece out or not. But that said, that's what our plan was, and just to sort of be as off the cuff as we could today. And I think we're doing that. But yeah, we spent a lot of time talking through this, and I think had our own reservations and went through sort of a process of like, do we feel comfortable talking about this and all of that? But I have to say personally, I'm really happy that we are, because it's something that's on my mind a lot, and I think I hope people will be interested to hear it. And what do you think, Julia?
Yeah, it's an interesting topic because it's sort of like an intersection between mental health practice or the work around mental health care and like linguistics and like social norms, and even how like algorithms sort of encourage certain ways of speaking. And and I think that's like where my hesitation came from, because like we've talked about, like I think there is this linguistics component that I don't know anything about and I'm not comfortable with. And so I don't want to, I don't know, act like I know what I'm talking about in that vein. But we can just talk about how this impacts us as like regular humans out in the world and as therapists practicing and working with clients.
Yeah, and I love that you're kind of bringing that up, because for a couple reasons. I don't know a lot of people that would be as thoughtful in the sense of like, am I allowing myself to speak on a topic that I don't know much about? To be honest, I think there are more people than, and this is a generalization, but I think more often than not, especially when we think about online content, people are often speaking about stuff they're not experts on.
That is true.
I want to say more often than not, and especially with the mental health field. So for us being, licensed therapists for a really long time, both of us have about just over a decade of experience, 2 decades between the two of us, right? I do think that we have enough expertise in that sense. Like, this is our job. It's what we do day in and day out, and have been for the last decade, to actually speak on some of the mental health terms and things that are going around. From a linguistics perspective, I think, that you're right in that that's its own field. And we can't, pretend to be experts in that, nor are we going to. Like, we're not experts in linguistics. But what people are seeing and being exposed to online, also, it like none of that waits for the expertise to pop up and say, no, that's not actually accurate or not. You know what I mean? So from a mental health perspective, that's what we're going to be focusing on. At least that's what I feel comfortable doing. And I'm okay with that, because myself, Julia included, we've both been adequately trained, and I think we know enough. And some of the stuff that I don't know about, I'll just say I don't know.
Yeah. It's really liberating to just say, I don't know, when you don't know, rather than to kind of act like you do. But no, it's interesting. Like, I don't know why this is popping up. This is like an adjacent kind of, or sort of relevant to this topic. But I think like a lot of these buzzwords, people don't even know, is this like a real term, or is this like something that was made up on TikTok or something? And like what's coming to mind is like sometimes I scroll through do you know Harrow, like Help a Reporter Out?
Yeah, I think they might have changed recently, but
they did, and then they changed back.
Oh, I didn't know that. Okay.
Like a year or two ago, I remember specifically there was like this call out for therapists to respond to like, what is bed rotting? And then they linked all of these TikTok videos about like rotting, and they're like, is it healthy? How would it help someone cope, or is it harmful? And like all this stuff, like it's just like this made up thing.
Yeah, it's not a clinical term, bed rotting.
No, but like the way they ask, it's like, I don't know. It's like asking about something that's real or something, and it's like so
like a
strange.
diagnosis.
Yeah,
almost.
or like some sort of coping mechanism or something. I don't know.
Yeah. No, I think that's a really excellent point, in the sense of like, that's one of the main reasons I wanted to do this episode, is because the way that people talk online, there's no way for you to really verify or know what their expertise is just by the way that they're presenting themselves or the way that they're talking about something. So that's something that I think is really important in so many ways. Both it allows misinformation, disinformation to sort of proliferate online, and that includes within the mental health field. Like bed rotting is not a clinical term. It's not this. You're absolutely right. It's not something that mental health professionals have identified as a thing or a
Right.
coping
Like there's
mechanism or
no
yeah,
definition for that. Like, so to give an
no.
opinion is to kind of make up your own definition and then give your opinion on that.
Yeah, and I think there should be a disclaimer, honestly, saying, well, first of all, this is not a clinical term. It's not something that mental health therapists or psychiatrists, psychologists, whatever, came up with. No, this is like pop psychology. That's
Yeah,
really what
and
that is.
this is like a trending
Yeah,
keyword or something. And that's kind of what I was
exactly.
saying before. Like, there's a lot of ways of communicating that will get you more or less traction in like
Hmm.
social media. And so people are going to
Yeah.
talk that way. And
Yeah.
it's not necessarily the correct way that's going to get
Yeah.
you the most views.
No, and I think there's a lot of, there's some awareness building around that. But
Mm-hmm.
I think it is so important, especially from a mental health perspective, because we're talking about people's minds and health. It is healthcare too. Like,
Mm-hmm.
are we using these terms responsibly? Is sort of what I'm most concerned with. Like, and I don't think we
Yeah.
are all the time.
Yeah, I know that's like a big concern for you that you've brought up. Maybe
Yeah.
you can share a little bit more about that concern.
Well, thank you for asking, Julia.
Mhm.
No, it is, but I also want to hear your perspective too. And you and I have talked about this before, but I guess for me, because I professionally, I identify myself as a trauma specialist, which is different from somebody that is trauma informed. Um,
Yes.
and that,
Please
and
tell us the difference because I don't
yeah,
know.
yeah, and I also want to hear with your specialty, right, which is different
Mhm.
from
Mhm.
and maybe you can kind of compare. We can like give a good example of what that means, like trauma informed therapy. You've people have heard the term trauma informed. It's overused, right? It's anybody can kind of call themselves trauma informed. Literally, they can just like Google it and then say, okay, I'm trauma informed now that
Mhm.
I've learned that I've read this,
Mhm.
or not. They can just call themselves trauma informed, whatever. And it's something I think that has popped up a lot in the wellness sphere, which, to be fair, like, I have clients that I've recommended going to do yoga for, and I will sort of try to recommend yoga instructors that I know have some training in mental health. And some of them I do feel comfortable saying, yeah, they are trauma informed because they've made that effort and they've studied it a little bit. And there is sort of an overlap there because
Mhm.
it's body, it's somatic. Um, that said, I don't think a lot of people are actually aware of what trauma informed means. There are no regulations. There are no established industry wide regulations within the mental health field that have established what trauma informed means. So really, it could mean like absolutely anything and nothing at all, right?
Mhm.
Trauma
Yeah.
specialist, from a mental health perspective, is somebody that has literally done specific specified training in the treatment of psychological trauma. And so they've studied both the theoretical aspects of it, the history of it, some of also the science behind it. Like, studies have shown that certain therapies work for certain reasons and the mechanisms behind that and all of that. And also probably have, not probably, they should or do have experiential training focused on the work of working with someone with trauma through a trauma informed, not trauma informed, but trauma like focused therapy, for example, EMDR or IFS, informed internal family systems, AEDP. There's so many different modalities,
Mhm.
but I'm just listing off some of the more common ones that were specifically, mostly
Mhm.
used for trauma. So for instance, I got a specialization in this. It took me about 2 years plus, more than 2 years, because I've actually done a lot more than 2 years, but I've got a certificate that's a postgraduate certificate. So it's something I did after I did my graduate degree in mental health counseling, and after even I got licensed. And so it was an additional certification, kind of like a specialist in, like a doctor that specializes in dermatology or in, like, I don't know, something,
Right.
endocrinology, right? Like, it's not exactly like that, but it's mental health is based around the medical model. So that's the best comparison I can make. So it's kind of a long-winded answer, but trauma informed versus trauma specialist, two very different things. Neither of them are actually really super regulated, but within the world of the trauma specialists in therapy, at least in New York City, where we were trained, it is recognized, like, that among the professionals, are you trauma informed versus trauma specialized? And if you say specialized, they'll know what you mean.
So that means you have a certificate through some sort of training
Yeah,
program focused on trauma treatment.
only focused from that lens. And again, like, not every program is equivalent or as good or
Right.
whatever, but and that needs to be said, but also at least the intention is there.
Mhm.
And I think we'll probably get to a place where it is going to be more regulated.
Got it. Okay. So then being a trauma specialist, um, what concerns come up for you around like mental health buzzwords?
Oh, well, so right now I think that the term trauma is thrown around so much online, particularly, that it's
Yeah.
to the point where it's actually sort of reduced its meaning, really.
Yeah. I mean, yeah, the word trauma, yeah, it has become a buzzword. And
Yeah.
I think if you ask different people, they would have different answers on what that word means.
Yeah. With
Even though, I mean, there is
yeah.
like an actual meaning to it, but then what
Yeah.
people think it means or feel it means or like use it to mean in the moment can really
Yeah.
vary.
Yeah, and they can weaponize it as well, or they can
Mhm.
use it to make somebody else feel bad, like, you caused trauma, or you caused
You
my traumatic.
traumatized me.
Yeah. Yeah, and look, there are times when that's true, when somebody was
Mhm.
traumatized by an individual. I have a caseload full of people that have struggled with things like that, but
Mhm.
not all the time. And what it
Mhm.
does, I think, oftentimes is it gives permission to certain people to not just weaponize it, but to manipulate it and
Mm.
kind of use it irresponsibly. If you say, I stubbed my toe and now I'm traumatized, that's not a responsible way to use that word. The word trauma is in and of itself supposed to mean something that's very severe. Trauma
Mhm.
itself is the definition of it, when you think of like PTSD and the DSM, so so post-traumatic stress disorder specifically, one of the criteria is, like, you're experiencing something that is so severe that it overwhelms your ability to cope. Right
Mhm.
now, that PTSD has more criteria than that, but, like, as a general, an overall general sort of definition of trauma, that's generally what is accepted in
Mhm.
the field. But because it is kind of vague, you can kind of, throw things in there. And our definite, the other issue too is that our understanding of trauma has expanded as well. And so things that wouldn't have been considered trauma, maybe like psychological trauma, maybe 20 years ago, even 10 years ago, are considered trauma by, professionals in the field.
Mhm.
So, and that's important too. So I think what it is that it's both sort of um, exaggerated and also diminished simultaneously, and that
Yeah.
really, that's not a great thing.
It's true. And I think because that word is so popular right now, I think
Yeah.
it's also very popular for practitioners to say that they're trauma informed just because they're
Yeah,
like, oh, this is in demand. So I'm going to market myself this way. And then that almost like perpetuates this idea that like
it does.
everyone
Mhm.
has been traumatized.
Yeah.
And which, yeah, then also kind of like dilutes it
Yeah.
in a way. Or
Yeah.
yeah, I don't know, pulls away from the actual like trauma that people have been through.
Yeah, it diminishes the trauma that
Yeah.
people have been through. And this isn't to say that, you know, that we're sort of putting these things on a hierarchy. It's just
Mhm.
that there needs to be a certain like standard so that people
Yeah.
don't misuse the word and
Right.
therefore end up, in the long term sort of causing more harm in that way. And it's I do
Mhm.
want to say also like it's not easy. Especially even professionals in the field that our understanding of it is really still evolving.
Yeah.
But I do think that people need to be more responsible in the way that they've been using it, especially recently.
Yep. I agree. Yeah, it's become way too pervasive.
Yeah.
Yeah.
You know, I just want to
Yeah.
say one last thing. I'm sorry.
Yeah.
I'm very passionate about this, but um, when I first decided I wanted to specialize in trauma, I was like, well, this makes sense because a lot of the people that I've worked with just have, this. My thought process was like, that's what I'm seeing a lot of and what I'm most interested in.
Mhm.
I went to coffee with a therapist friend a couple of weeks ago, and we were talking about like developing your niche and all of that, which is basically just like it's marketing stuff
Mhm.
for your private practice, which a
Mhm.
lot of us are a little bit uncomfortable with as therapists.
Mhm.
And she was like, I was asking her, well, aren't you going to say something about your trauma training? Because I met her in the training program,
Mhm.
and she was like, yeah, but I don't know, I feel uncomfortable with it. She basically was just expressing something to the effect of like feeling like it was a little bit of an icky word because it's so overused,
Mm.
which is it does such a disservice to the therapists that have spent years and both experienced time, money, training,
Mhm.
and not just that, for their clients, for the people that really do
Mhm.
need like a trauma lens.
Mhm.
How are they going to find her if she
That's
doesn't,
very true.
So
Mhm.
that's just one example that I can think of. But I'm going to pause there.
Yeah, no, that's really interesting. Yeah, it's like not something you would really think about as a side effect of this word getting overused.
Yeah, and I mean this person in particular, I have so much respect for her. She's such a talented therapist
Mm,
that like
mhm.
to have her not, let people know about it, that's too bad because she could help
Yeah.
a lot of people.
Yeah, yeah, people that might be looking for someone that really has that specialization and they're just going to bypass her if she's not calling attention to it.
Yeah.
Yeah. So, I guess this all kind of leads to like what do you think ideally should happen with the use of this word?
Oh, that's a good question, and I don't know. I don't know what the answer is to that. I think, I mean, I'm just going to brainstorm right now, but I think that it should start with mental health professionals, or it could start. Okay, I'm going to start with mental health professionals just because that's what I know.
Mhm.
But because we're the ones that, have, for lack of a better word, we're kind of the experts. I don't know why
Mhm.
I feel uncomfortable saying that, but, we're like,
Well,
that's our
because
work.
like you said, it's an evolving thing. We're always like
Yeah.
growing our understanding of it. So there's no like finite amount of information that you could master. Like it's just
Yeah.
always growing.
Yeah, and it's evolving so much, like,
Mm-hmm.
especially recently, but yeah, that's a really good point. I guess the first thing I would say is that I think mental health practitioners, therapists, social workers, psychologists, psychiatrists should actually make an effort to sit down and properly define, um, m- you know, have more of a robust definition that doesn't exclude certain groups, but also, you know, it's very hard to make concrete, but there are some guidelines that we could use to sort of outline things. And then I think a second step to that would be sort of taking the mental health professionals and bringing in like media experts and having the media experts help us figure out like how do you can we start thinking about putting disclaimers on things? Are there things that can be regulated honestly at the state level or higher to say that, you know, you can't claim that you're an expert on this. You can't use these
Mm.
terms without first acknowledging that you're not qualified to use them. You know,
That would go a long way in a lot of fields. Yeah, just in general, people just deciding that they're gonna pitch themselves as an expert is like a major issue right now.
yeah, and it's real. I just it makes me wonder. Like, I mean, people really have chutzpah. Like, I don't know how else to say it. Like, they have,
I don't know how people do that.
like,
I would feel like that is such an irresponsible thing to do when
yeah,
you're giving advice under the
yeah.
guise of an expert when you're actually not. Um,
It
it's
happens so.
horrible.
Yeah, it
But
happens so often, and it's not helpful either. I think that the way that our field has evolved. There's so many different types of therapists, and people don't know what they're looking for.
and
So
they
you can
don't know
get
the
some, yeah,
difference between
no,
different
no,
letters after someone's name or
yeah,
not. I mean, not everyone has them, but also some people have them and they're just sort of like from unaccredited
yeah,
institutes. And then you might have like someone who has like 3 doctorates and it
none of
looks the
them are,
same if you don't
yeah,
know what the letters mean.
yeah, none of them are specifically related to like the experience of providing psychotherapy, or
Well,
it's
that's
like,
true too.
or,
Yeah,
yeah,
you can have all kinds of letters that don't
yeah,
relate to the thing you're doing, but
no, yeah,
I mean, it's such a complex issue. And then we were talking earlier, like the other day, about kind of one, I don't know, like complication in this whole idea of what to do about it. Cause like when we as therapists are in a session with a client and they might be using this word or
yeah,
another word in the way they mean it in that moment, which may not be
yeah,
correct. And then we are kind of in a position where we can go with that and just like assume like we understand what they
yeah,
actually mean or kind of break
yeah,
the continuity of what's going on there for like a teaching moment or something, which
yeah.
usually doesn't feel like the right time and place.
No, and so from that perspective, it makes sense that some of this stuff has happened where like I often don't feel comfortable like making corrections in the moment in a therapy session because it will derail the processing. It's like
Mm-hmm.
who cares if they're really getting the term correct or correctly or not? Is in that moment, who cares, right?
Yes.
Obviously, afterwards it
Right.
matters, but in that moment, it's like, look, if that's what it feels like to you, I'm not going to invalidate your experience or make you feel ashamed for using something that you weren't trained on and that people use so like
Yeah.
freely anyway.
Right, because there's like kind of the colloquial. I can't even say that word.
Uh, collo-
Colloquial. I
I,
don't know.
I think you got it.
The colloquial
Colloquial.
usage of
Yeah.
a lot of words that have like a technical meaning and then
Yeah.
like kind of a day-to-day conversational type meaning. And yeah, no, it's like you have to navigate those moments as a therapist, because by not correcting it, you're sort of like tacitly validating
Yeah.
the usage, but
Yeah.
you know, you have to like weigh out what's more important. And
Yeah.
yeah.
And there isn't a concrete like yes or no guide for something like
Mhm.
that.
Mhm.
It really is just like what's more important in the moment. How do we get this person, my first goal in sessions is that individual person. How am I going to help this person heal? Is
Exactly.
right. And
Exactly.
if
That's
that takes,
the
yeah.
that's the point of the relationship, not to like perfect their usage of mental health words.
No, and I think there are some ways that you can go about doing it as long as it doesn't, but it depends so much on the circumstance and the context and, as
Yeah.
do a lot of things in therapy in general. You
Yeah.
know, I had a
Yeah.
question for you actually about your specialty,
Yeah.
if you don't mind, and unless there was something
Sure.
else you were going to ask.
No. No.
So I mean, and correct me if I'm wrong, Julia, you're a
Mhm.
certified in REBT, is that right?
Mhm. Mhm.
So for those who don't know REBT, maybe you can you,
Yeah.
I don't know, if you
Oh,
can kind of give a
yeah.
quick rundown of that.
REBT stands for Rational Emotive Behavior Therapy,
Yeah.
behavioral therapy, I should say. And it falls under the cognitive behavioral umbrella, but it also
Mhm.
falls under the existential therapy umbrella.
I didn't know that.
Yeah, it's really like it's a counseling theory as well as kind of its own philosophy on
Okay,
human emotion. And
cool.
it's really cool. Like I love it. And it's allowed me to kind of branch out into more and more existential stuff, which I'm
Nice.
really into right now. But it also is like so grounded in really like pretty easy to understand principles about
Mm,
how your thinking affects the way you feel, it affects the way you behave, the way you interpret things, the way you respond to things. So if you're having any issues in those areas, just really examining your thought process, your attitude towards different aspects of life,
yeah.
you can really start looking at like what's helping me, what's getting in my own way, what's really true,
Mhm.
what do I actually believe. Like
Yeah.
sometimes people will go on sort of believing a certain thing because they haven't really analyzed it and realized like, wait, that's
Yep.
not how I want to see the world. I don't think that's
Yep.
right. So REBT really helps with that. And I think it's
Nice.
really, really an interesting process, and it's very empowering.
Hmm. I
Yeah.
I I just it's like a pleasure listening to you describe it because you're so passionate about it, you know?
Mhm. Mhm.
And for those of you who are listening who might be new to therapy, like that's you want somebody that is really excited by what they do because it means that they've put in a lot of time and effort and they're concerned about doing it well and want to
Mhm.
do a good job. Um,
Yeah.
you know, but from it makes me when you were talking about that, it made me think of a client that I had actually referred out to somebody that specialized in another kind of like cognitive behavioral therapy.
Mhm.
Um, and the reason I did that was that I thought maybe for what this person was struggling with, that a more sort of so I think of like a lot of cognitive behavioral therapies as being like very practical, like
Mhm.
very practically oriented. Like,
Mhm.
you're going to examine thought processes and you're going to kind of break it down and kind of look at those components and try not to get stuck in things that are not serving you. And
Mhm.
there's something, nice to be gained from that. So I thought for this person in particular, it would be helpful, especially because it was somebody that was struggling with kind of more OCD-like
Mhm.
symptoms, which
Mhm.
CBT is generally recommended for.
Mhm.
And so this person went to found a different therapist, and the therapist had advertised herself as being as having specialty or experience in CBT.
Mhm.
And then when she went in, the therapist was like, "Look, we all do training in CBT. I don't know what a CBT specialist is. It's just we can all do it." So, and basically what that told me was that, okay, this person doesn't think about different specialties and
Doesn't
is really
even
just more of a
know that you can.
no,
Yeah.
that's she's a generalist.
Right.
And I think a lot
Oh,
of, yeah, it was really disappointing.
that's painful.
Yeah. And I did
Mhm.
end up, advising my client to look for someone else, honestly,
Yeah.
because
I mean, it's a similar issue. It's true. Pretty much any graduate like any grad program, like when you're getting your master's is going to talk about CBT, and therefore you can then go out and say I know CBT, but it doesn't
yeah.
really mean that.
No, it means you've had an introduction to it. That's really all it
Yes.
means.
Like
Yeah.
I get the gist of it.
Yeah.
Yeah,
Yeah.
have I trained in it? Have I really gone into the depths of it? Have I gotten supervision around this?
Yeah.
Have I been assessed for my skill level in
Right.
this? Yeah.
So all those things that Julia you just mentioned, that's also the difference in a specialist versus somebody that's more of a generalist that just kind of has an introductory knowledge of it,
Mhm.
including trauma. CBT as well is in these programs, you are individually assessed doing those techniques with clients.
Right.
So, and you typically have somebody that's either like a consultant or supervising you, basically,
Mhm. Mhm.
until you get to a place where they can say, okay, you've kind of absorbed the skills, and now we can
Yeah.
say that you're at whatever level, and you have extra
Right.
expertise in this, basically.
Yeah. And it's like it's really intensive work. Like I remember
Yeah.
when I was doing some of my training, I had to record a lot of my own sessions, and I
Oh,
I
it's
had to
brutal.
go through them with like different supervisors and stuff. And it's like you do
Yeah.
a session, you review it, you do another
Mm-hmm.
session, and that was really dreadful. Like I hated the
Yeah.
idea of having to ask a client, "Can I record our
Oh, I hate
session for
that
my
too.
training?" But
It's the worst.
in any case, yeah, I think it does indicate a certain level of like passion and devotion to being a good therapist that someone would go through all of that because it's
Yeah.
completely optional. You can legally
Right.
practice without that.
Yeah.
Yeah. So,
And I do think it's, and to this person's credit, I think the therapist was maybe a new graduate, you know?
mhm. Mhm.
Um, but I do think that that's sometimes even in our field, like there's confusion around it, where, in the medical field in general, which I mean, we are a part of, but medical doctors, for instance, doctors, nurse practitioners, physician's assistants, they have designated specialties, right? Like
Mhm.
you don't go and get surgery by somebody that's not a surgeon. You don't,
Exactly. Yeah, there
you
are
know?
more rules around that. Yeah, like you
Yeah.
can't be like a general practitioner and call yourself a gynecologist or something?
Yeah. No, you absolutely can't because
Yeah.
you don't have the depth of knowledge or the specialized
Mhm.
training. It's really just the specialized training.
Mhm. Mhm. Yeah,
Both
that
those
is
things.
interesting, but in our
Yeah.
field,
We don't have that yet.
yeah, that's and it does make it really hard for therapy goers to discern the
Yeah.
difference because if everyone's saying they're an expert, you
They're
don't
not.
know, like, what's real and,
Yeah.
like, who actually is and who isn't.
I think that is in general like a shortcoming of our field, honestly.
Mhm.
You know, those standards are there for a reason. And if they weren't, everybody would call themselves healers and then, you know, kind of do makeshift therapy where they're maybe even, doing some harm, honestly. It's because if you think about it, if there's like an established guidance around what it takes to become licensed in a field, you have to have a certain level of arrogance to say that that doesn't apply to you. I'm sorry to say this, but
Yeah.
I've seen it too many times. And that arrogance, especially in the field of counseling, is actually not going to make that therapist particularly effective because they're just going to be listening to themselves as opposed to their clients.
Yeah. I
So
mean, that's a major flaw in someone's perception of themselves. And yeah, how are you going to be helped by someone who's that askew?
yeah, that's a failure of judgment,
Yeah.
or self reflection. What is it?
Self-awareness.
Insight, self awareness. Thank you.
Yeah.
Yeah,
Also, like, no regard to the possible harm you could
yeah,
do to someone else, or at the very least, even if there's no impact, you like cost that person time and money. They
yeah,
thought they were going to get help and they got nowhere.
yeah, yeah.
Anyway, as per usual, we had like a million things we wanted to talk about here, and we just
We
like kind
did.
of zeroed in on a very specific thing, which I like, but
Me
I
too.
think like we can't really promise what we're going to end up talking about because
You might be right. I mean, to be fair, I think we could try if we wanted to check this out again. I don't know if you want to hit pause or end on this or
what?
well, we could always say, okay, we are going to look at this list of, things that we found on Reddit.
Well, we still can. We still can.
Yeah.
Yeah. Well, yeah. So in preparation for this mental health buzzwords episode, we did kind of go through some Reddit stuff and well, we also kind of brainstormed some words that we thought kind of came up. I can read off like our brainstorm words that What?
I mean, what I'm thinking is maybe we just let this episode sort of speak for itself, which is like a general sort of overview of like the potential pitfalls of mental health buzzwords. And then maybe next time we could get more specific about like, let's actually look at these specific sort of mental health buzzwords and go through them. What do you think?
Yeah, I don't know. We don't have a plan. So,
So it's just us talking.
Yeah, I'm just looking through the page that we had written stuff down.
Sure.
Yeah, I mean, I think yeah, basically we could, I don't know. Maybe we just leave it. Like you said, leave it.
Yeah.
Okay. And then
this could be a two-parter.
Yeah,
or something.
Our next episode, we can, well, we'll try again to get through the list.
Yeah, exactly.
Yeah.
And, maybe we'll just like, I know personally I could just like print it out and put it in front of me so that
I've had it in front of me this entire time.
Oh.
Yeah. But I think the thing is like we both like to go like deeper into something specific than to like touch on a lot of things on like surface level.
I think you're right, and there's nothing wrong with that. It's just that I mean, ideally I would have wanted to like go through that list as like I don't know if this is what you were thinking, but like I'm looking at the list right now. Like, so here's one. Over time, the following mental health terms have been weaponized or become pejorative. So the term, and then go down the list and then sort of attack them one by one, maybe. But
I mean, I feel like we kind of, like, without that reading that exact line, I feel like we started doing that. And like the first word we really got to was trauma. And then we
it's
just
a loaded one.
spent time on it. And
yeah.
But that's fine.
We could, yeah. I mean, so who knows like what we're going to do when we edit this, but we could also like record an extra thing and say, here are some, and do like a short, like let's
like a
read through
bonus
this
episode.
Yeah, like, yeah, a bonus episode or a quick, like, because we didn't get to these, we're going to specifically we're going to spend the next 20 minutes, focused on, okay. 1, 2, 3, 4, 5 buzzwords.
Okay. Well,
and keep a timer or something.
So, I mean, we could just like stop this recording and start a new one and do that now
we could.
with like our remaining time. And that'll keep us on track.
Yeah. Do you want to do that?
Yeah. Okay. So let's just like say goodbye then.
Yeah. Yeah.
Okay. So yes, we didn't get to 99% of all the ideas we had for this episode. So we're going to leave it at what we've got right now. And we're going to just do a quick bonus episode to just kind of run you guys through the gist of some of the other buzzwords and things that seem to be coming up quite a lot, and our quick thoughts on that.
100%, I agree. And just a quick, note on that. I think what we did have to say today, while it was windy and, there was a lot of sort of depth to it, it was also important and gave us kind of an opportunity to really think through some of the implications of, this is a broader issue. What happens when mental health words just kind of enter into regular conversation? That's also really important to look at. So I'm happy that we talked about this, and I hope that you'll listen to our next little quick bonus episode. You could listen to it before also. It's up to you. And thank you for listening.
All right. Till next time.
Bye. You were just listening to Keeping Secrets, hosted by Sabrina Tropper and Julia Baum. If you like what you heard, leave us a review or a comment. We'd love to hear your suggestions, comments, questions, and topic requests. We do our best to respond to every single one, and you may even hear yours discussed in an upcoming episode. And don't forget to subscribe to our YouTube channel or wherever you listen to podcasts, and find us on Instagram and YouTube at Keeping Secrets Pod.
Keeping Secrets is the brainchild of Julia Baum and Sabrina Tropper, who also produced and directed this podcast. We're also responsible for all writing, research, graphic design, sound engineering, and video editing. Transcriptions by Riverside. As a reminder, this podcast does not constitute medical advice. While we strive to share the most accurate and up-to-date information, human error is to be expected, and this podcast is purely for entertainment purposes.